The country is small. Well, that helps with getting shots in arms. But Palestinians in Gaza and the occupied West Bank still don't have access to the vaccine. That is a worry. When it comes to Israeli citizens, though, they are being vaccinated faster than anyone else in the world. There are drive-through vaccinations. Some clinics run 24/7. There are enough ideas at work to intrigue Canadian Dr. Tara Kieran, a leader in medical innovation.
Paramedics are one of the groups that they have co-opted to help them to deliver the vaccine. I think in Canada, there's been, this focus really on relying on our nurses who are already very stretched due to COVID-19. And I think that taking an all hands on deck approach is really important.
Digitized medical records in Israel mean notifications of appointments are online or by text. Canada is not ready for that. When I went to get a flu vaccine at the pharmacy, I actually have no idea how my family doctor found out, or if she ever found out that I did. What happens in this country?
Unfortunately, much of healthcare still runs on faxes. It is still done via fax, believe it or not.
The Israeli government approach is strong, but vaccine hesitancy is still stubborn, a phenomenon approached differently around the world. So in Spain, people can refuse vaccines, but a registry of refusals will be shared with the EU. The consequences of that aren't yet clear.
L'Italia rinasce come un fiore.
Italy's idea is to make a vaccination more like an event, planning beautiful pavilions for vaccine distribution, all marked with a primrose, the first flower of spring.
I love that approach of connecting this idea of getting immunized to doing something good for yourself and the world, to rebirth, if you will, to spring.
Physician Noah Ivers is with a Canadian coalition called 19 to 0, aiming to curate the best ideas to counter COVID and vaccine hesitancy.
The research shows that two things can be most effective at addressing vaccine hesitancy. Number one is advice from a trusted religious organization or leader. And number two is advice from a trusted healthcare professional.
I say thank you. I say a blessing to God.
To see rabbis vaccinated and imams encouraging it helps.
From Islamic law standpoint, it is absolutely fine and permissible to take medicine to prevent a disease.
Persuasion matters, Ivers says, but broadly, this all has to be about speed.
Maybe folks need a ride to the clinic. I think we can steal a lot from successful Get the Vote Out campaigns in that regard. We need to collate the lists of folks willing to work off hours, middle of the night.
The plea from health workers is if Canada wants to do better, it needs to approach vaccinating people like a disaster deployment. Because sadly, that's what it is.